Good afternoon, good evening, good morning to people from around the world who are participating in our forum. Welcome. I'm Nick Freudenberg. I'm a faculty member in the City University of New York School of Public Health and a faculty fellow at the CUNY Urban Food Policy Institute. And we're very pleased to welcome you to our forum, Targeting Ultra-Processed Food to Improve Nutritional Health. And I will have a few introductory remarks, and then I will introduce our panel, and then we'll jump right into the discussion today. And there are three starting points for our discussion today. The first is to recognize the growing role of ultra-processed foods, which we might abbreviate in this session as UPF, in the global diet, and that understanding that it is a primary cause of premature deaths and preventable illnesses in the world today. And that's true here in New York City, it's true in the United States, and it's increasingly true in many low and middle income countries. The second starting point for our discussion today is that ultra-processed food contributes to health problems via several different biological, social, and other pathways. And it also contributes to environmental, labor, and other types of social, economic, and health problems. In my view, the third point is there is a growing consensus, not universal, on these two starting points about the role of ultra-processed food in the burden of disease and the multiple pathways. But we do need more research on the role of these differing pathways in contributing to the burden. And we also need more empirical research on the specific pathways in different settings. And most important, we need research and action on effective strategies for reducing consumption and harm from ultra-processed foods in various settings and for differing populations. And our discussion today is how can we best understand and use this concept of ultra-processed food to inform that research and action. And let me tell you a little bit about who will be on our panel today. We'll start with Jenn Lacey-Nichols, who is a research fellow working with the Victorian Health Promotion Foundation at the University of Melbourne in Australia. And for Jenn, it's Friday morning, and so we welcome her view of the future of ultra-processed food. Our next speaker will be Paula Johns, who is the co-founder and director of ACT Health Promotion in Brazil. And that's a coalition with more than 1,000 members, started its work on tobacco and then expanded in the last several years to working on non-communicable diseases and the role of food. Our third speaker is Alejandro Calvillo, who is the director and founder of El Poder del Consumidor in Mexico. And this is a group that has been active working on food policy and other health policies in Mexico and has been effective in changing some of the government policies in that country. And our fourth and final panelist is Kelly Brownell, who's the Robert Flowers Professor of Public Policy and Psychology at the Duke University and the Director Emeritus of the World Food Policy Center at Duke University. And we're really delighted to have an international experienced crew of speakers for this panel today. And with that, I will turn it over to you, Jenn, to get us started.
Brilliant. Thanks so much for the kind introduction, and thanks very much for having me. If I'm a tiny bit inarticulate, please forgive me. It's 7:30 in the morning, and I've just woken up my toddler. Good morning. I'm just going to talk for maybe 5 minutes, hopefully set the scene a bit, based on a paper that Nick and I spent several years writing, courtesy of COVID and a baby. And it's something I think that a lot of people have been thinking about as the ultra processed food concept really reaches, you know, the sort of decade of existence a little bit more now, to sort of think about how the concept has evolved, how it's been taken up or not taken up, and the various ways that it's been interpreted by different stakeholders, whether that is health professionals or whether that is the food industry. So it's really interesting to sort of think about. I guess our premise is, you know, it's not a perfect proxy for all of these potential problems within the food system, but it's a potential one, and it's often a really good conversation starter to get people interested in this and to get people over the line to start thinking about some of these issues. Before I go any further, I want to acknowledge that I am presenting on the lands of the Wurundjeri people of the Kulin Nation in what is now called Melbourne. The sovereignty was never ceded, and I pay my respects to elders past, present, and emerging, and any Indigenous peoples that are joining us from the audience today. Thank you. So our essential, our sort of hypothesis argument is that the ultra-processed food concept, which comes from the NOVA framework, which is all about measuring the extent and purpose of processing of foods in the food system, is interpreted in two different ways. And we would argue that the one on the left, that narrow framing, kind of misses the point of the ultra processing framework, but just have to say it is a common way that it is interpreted. So there's a narrow framing, which is more sort of about the actual physical formulation and ingredients of these products. So ultra processing, we often talk about, you know, when we think about ultra processed foods, we often use euphemistic language and talk about junk foods and other things. But if we focus purely on the ingredients and the processing and the sort of technical element that sits inside of food, you often get technically not ultra processed foods perhaps, but ones that are very much still part of that industrial food system. So I just have some examples on the side there, which I think is interesting because it sort of suggests that, you know, we can have unprocessed or just processed foods, but still within that industrial food system, which isn't really, I guess, the goal of what a lot of people who have problems with the industrial food system at large want to achieve. And on the other side, we have what we're calling the ultra processing regime, which sort of speaks to the fact that if we're thinking about the extent and purpose of ultra processing as sort of the key defining characteristic, that purpose about making the foods, the cosmetic changes, what's sometimes called the hyperpalatability of this, and all of the different parts of the food system that help enable the production and consumption of ultra processed foods, that sort of system level is really what we're wanting to change and what the ultra processing food framework is trying to get about. Suffice it to say, we see examples of this across policy and different sort of dialogues. So I guess if we say, we can see it in two different ways. The one on the left, the narrow one, isn't really what we want to do. What then is the potential for that sort of broader regime framing? There's three sort of potential areas, and this is really where all my lovely colleagues and everyone else on this call can probably provide a great deal more insight into this. So one is around sort of that linking of issues. As Nick said in the introduction, ultra processed foods is often conceptualized as that health concern, as a problem with NCDs, but the same manufacturers and producers of ultra processed foods are obviously invested in a great deal of other issues. Increasingly, there's research showing the sort of environmental footprint of the waste and the processing that goes on with ultra processed foods. So there's clear links to climate change, but there's obviously links to social justice, to unions, to human rights, to a range of other sort of issues. And so linking those together through that one ultra processed food concept is one way to perhaps grow larger alliances for that change. So I've got some examples of movements on the right. From a policy standpoint, sort of the exact same thing. Tim Lang and other colleagues have spoken for years about this need for joined up food policies, this idea that we can't have food just sitting within the health department or just within the education department. You know, we have to have treasury, we have to have all these different sort of departments. Thinking in a more integrated way about this concept might be a way to help sort of move those policies forward. And then lastly, and this is probably where most of my research had focused, I was just looking at that question of power. You know, ultra processed foods can of course be made by very small companies. I can make processed foods in my kitchen. I'm not sure if I, an individual, can make ultra processed foods in my kitchen, but it often requires a great deal of resources and sort of extensive supply chains. So really sort of looking at who are the key drivers and the vectors of the ultra processed food consumption and production really draws attention to those with the most power and influence in the food system. And so the last two things, I guess, were sort of our two ideas that we had about how the ultra processed food concept might be useful to sort of, I guess, move forward where we are in this in our progress to sort of fix the many problems of the food system. And so one is to focus on the purpose. So the NOVA framework is about the extent and purpose. And the purpose really sort of says, well, a particular food can't have a purpose. It is an inert object. You know, it doesn't have desires and ambitions, but companies can. And so really thinking about who is actually driving this creation and what are the motivations behind it really starts to move the focus away from sort of physical, technical questions about food towards political and social questions about who are the actors in this system. So I've just got some examples here about that. There's often the food industry's response is often, like, well, processed foods aren't bad. It's like, of course they're not. Processed food is quite literally part of the NOVA framework. And all those foods on the right, the cheese and the pickles and the bread, those are processed, but not ultra processed. The ultra processing is the cosmetics, the stabilizers, the thickeners, the emulsifiers, the other bits and pieces that are designed to sort of imitate those foods. So that's point one. The other potential idea, and this one is very interesting to me, and open call to the audience, if you have examples of food companies that specifically use the term ultra-processed food, I'm very curious about this. I sort of anecdotally collect these as I go. But the one example I found is in that debate around meat alternatives, fake meat, meat analogs, whatever term you want to use, and the sort of red meat, unprocessed meat and the dairy industry to an extent, having that debate to sort of say, well, all of these new plant-based alternatives are ultra processed. And it's really interesting to sort of see for the first time, this is the Center for Consumer Freedom. So if anyone has worked on food or tobacco industry issues, we kind of know the general perspective and vibe of that. So it's very interesting to see a relatively right-wing conservative organization adopt a public health nutrition term, leverage it and use it strategically. And I think that is a really interesting thing, in the same way that if we look historically, we've seen the concept of food security or whole other sort of initially advocacy transformative turns co-opted and taken by the food industry. How this debate and this dialogue will play out, I don't yet know, but I think it's really interesting to observe what's going on here. And with that, I will stop and hand back over to Nick. Thank you.
Great. Thank you so much, Jen. I'm going to pose questions to our panelists that will help us to dig into these questions in a little bit of detail. And Paula, I was going to start with you. And you have noted that Brazil, in the last decade or so, that two sectors of the food industry that have previously been separate, the commodity sector companies, international companies like Cargill, JBS, ADM, and the consumption industry companies like Nestle and Mondelez and Pepsi and Coca-Cola, have come together in a new way and developed really a shared agenda. And can you explain how this new alignment is playing out in Brazil and what its relevance, if any, is to this idea of ultra-processed food?
Thank you, Nick. Well, hello, everyone. Good morning, good day, good evening, depending on where you are in the world. Well, it's a pleasure having this discussion. And as a Brazilian, I'm obviously very proud to see the discussion on ultra-processed foods and the NOVA classification, like gaining this global momentum and more evidence supporting the original hypothesis. Yeah, what's happening in Brazil that we have observed more or less in the last 10 years, if you think about the NOVA classification back from 2010, and then you have the Brazilian dietary guidelines for the Brazilian population from 2014. And before that, the Brazilian rural community, like in the National Congress, they have always been like the agribusiness actors, stakeholders in the National Congress. They have always been very powerful throughout the Brazilian history. We are a large exporter of commodities, but what's relatively new phenomena now, it's that they are joining forces through like, I'll make a long history very short for the sake of time, but they have joined forces in a lobby house that they co-found. So they have collective funding, like a crowdfunding, and this crowdfunding comes both from the commodity producers and the ultra-processed food industries through their associations. And they have a really well-designed and well-thought structure of lobby for advocating for their agenda. And then when you look at the agenda, what they are looking at, each one of them, they are the godfathers of one politician. So there is a kind of a public-private partnership there, and funded by these sectors. And they are monitoring really closely every single bill that relates to either like, we go from issues from like indigenous rights populations, big conflicts in Brazil, now a big crisis, you might have seen it in other places in the world. It's really horrible what's happening here right now. So it goes from like environmental crisis as well, or conflicts about regulatory issues for land. So you have like the agenda of the tax reform, and then you have the agenda of like the regulation of ultra-processed foods. All of these agendas, it's this group that they're taking care of. So it makes it like really difficult for us as advocates for food policies to move further in our agenda, because it's such a well-organized parliamentarian front that has so many strong politicians there that it's really hard even to have debates about some of the issues that we would like to debate in the National Congress, as for example, the taxation of like ultra-processed beverages. And then I'll make the link between like the second part of the question is like, how useful is the concept of ultra-processed? We have been having discussions in Brazil. Well, I come from tobacco control. So from my perspective, it's so crystal clear that we can make the comparisons between like ultra-processed foods and cigarettes, right? As a unique category, not for the good, for the bad, but that needs to be regulated in very similar ways that we have been regulating tobacco, right? The 4 major policies that it's about like regulating like school environments and other institutional environments to avoid having these foods there. It's about taxation of these products, and it's about like restricting advertisement and front of package labeling, like this package of these 4 policy areas. So it's a very useful category for making it simple and clear for people to understand what it is that we're talking about when you talk about that. And of course, here we have like the support from the Brazilian guidelines that makes it very explicit what type of foods you need to avoid. And these are the ultra-processed foods, and that children should not be consuming those foods. So we are using this concept in the discussions about, for example, the tax reform. It's limit how much we can advance. Of course, we started like with sugary beverage and also, but not only sugary sweetened beverage, but also artificially sweetened beverage, and using the concept of ultra-processed, not to get into the discussion of whether the artificial sweeteners are good or bad. We don't need to get into that discussion. We go directly like from, okay, ultra-processed, these are under the category of ultra-processed. So it's a very useful category for us for having a simple message for the population as a whole. So it has a huge value.
Can I ask a follow-up question, Paula?
Sure.
and it's sort of building on some of the things Jenn was talking about. And that is the potential for the ultra-processed food concept in the way that you were just describing, bringing together health activists, environmental activists, labor activists. Is that happening to any extent in Brazil? And what do you see as the benefits and challenges of that strategy?
It is happening very much around the discussions on the tax reform, which are with the new government, they are gaining momentum in Brazil very strongly right now. So we are having these conversations with the environmental movement and with the social justice movement to talk about a tax reform that needs to be solidarian, it needs to be sustainable, and it needs to be healthy. So we are having like many, we are also having many discussions about with the social movements from these areas, and like combining one of the priority agendas for the new Brazilian government. It's like both like the climate emergency, and of course like the Brazil is back in the hunger map. I mean, that's emergency top priority number one, but associated with the climate agenda, which is another political opportunity to talk about these issues together, not separately. So this is happening.
Right. And certainly in Brazil, a big contributor to deforestation is growing soy and beef,
yes.
You know, two very big, and not just for Brazilians, but to send around the world, to send to China, to send to the United States and to other countries.
And that's the major challenge, which relates back to the first point that I raised, which is like how well organized these sectors are. And as much as we are together as civil society organization pushing for those policies, they are also together as like this industrial sector trying to avoid that this happens. So there is a big like, I mean, we are literally like having opposite like arguments, but then one of the issues that you raised is about like whether like how does the industry is using those terms. They are also kind of in Brazil, they're pretty much like the Brazilian Food Association. They are countering the concept of ultra-processed foods. So they don't accept it fully. So, but at the same time, as they use some of the concepts that we use, like, for example, real food. So they are about to launch a new website saying, well, if there is food, there is truth. And they are using right now, I mean, because we are having these huge discussions about fake news and what happened because of the fake news factory, literally in Brazil, the political crisis and everything. They are using the concept of fake news to say that they need to combat all the fake news about like the exaggerated claims about highly industrialized foods. So they don't utilize the concept, but they counter the concept using other like trendy things such as fake news. Another ways that they have historically used this, for example, just right when Brazil launched the Brazilian food guidelines, Coca-Cola launched a big campaign, a mass media campaign, in which one of the things about our Brazilian guidelines, it's the importance of eating together, right? Sitting around the table and eating real food together. So they made a really beautiful advertising where the entire family was eating around the table, obviously with a Coca-Cola bottle in the middle of the table. So, I mean, they continuously keep using like some of the message that become important for like the public communications. So on their, I mean, to promote their own agenda. So that's the constant challenge.
Right. I'm going to move on. Thank you so much. And I have more questions, but we'll get to them. And I should mention to all of you, in about half an hour or so, we're going to open up to get questions from you, and we'll open up the chat when we're ready for that. Alex, in my introduction, I talked about how your organization, El Poder del Consumidor, has been successful in changing some policies, getting a tax on sugary beverages and others. I wonder if you could talk to what extent have you used the concept of ultra-processed food, and to what extent has that been useful in discussions with the public and with policymakers in advancing your goals?
Thank you, Nick, and thank you for this invitation and to share this event with Paula, Kelly, and Jenn. We didn't use the concept of ultra-processed food when we promote the soda tax on the front of pack warning level. The only reason was that we thought was not strategic at this moment. When we look for these very specific policies, for example, when we promote the soda tax, when Mexicans had the greatest sugar sweetened beverage consumption, and we need to reduce it, the focus was very clear, was to reduce the sugar sweetened beverage consumption. When we promoted the front of pack warning level, this warning level that you can see a kind of Coke, very big, that say excess of sugar, excess of calories. When we promote it, the focus was to talk about these ingredients that have a relation with chronic diseases, not sugar, salt, fat. And we took the experience from Chile. Chile was the first country that promoted this warning level. But what happened in Chile? For example, Coke removed the sugar from many of their products, and they introduced non-caloric sweeteners. And the health sector in Chile was very concerned because the consumption of these non-caloric sweeteners began to increase a lot. And you know, these non-caloric sweeteners are not healthy, and also are not safe, They are beginning to appear a lot of information about the risk of these non-caloric sweeteners. By this reason, we introduce in the Mexican regulation of the front of pack level a new sentence. It's like a warning sentence. Is very little is in the products that have non-caloric sweeteners, and say contains sweeteners that are not recommended for children. But this is a good example about reformulation is not a solution, because all the time the industry will find a way to introduce another ingredient that could have impacts on health that we didn't know now their impact. By this reason, we didn't discuss at this moment the ultra-processed food. But something that is interesting is the regulation that we began to introduce the concept of ultra-processed food was in a proposal that is now in the Congress to regulate food and beverage inside schools. Why? Because the government have the obligation to protect the environment inside schools, to have a healthy environment. The healthy environment is a right of children, and government have this obligation, and we have now this proposal inside the Congress using the concept of ultra-processed food. And as Paula mentioned, in the case of Mexico, we have now a project, very developed, of a new official dietary guidelines, that use the ultra-processed concept. And I think that is something that creates a relation, in the case of Latin America, the ultra-processed food concept, I think so, for many people that we are using this concept, we link this with the food system, and with everything that is happening, in relation with the environment and social justice, because everything is part of the same model, of the same food system that came from this monoculture, with high level of petrochemicals products, that have very strong impact on the environment, on biodiversity, no? And we need to recover the fertility of the soil, no? And this system of that we have ultra-processed food in one side, and in the other side, this model of agriculture, no, have this very strong, no, impact on the soil, no, in the fertility of soil. And for example, the dioxide carbon that is in the fertility soil was sent to the atmosphere with this kind of system. No, everything have a relation.
Yes, thank you. I think this concept of right to healthy food is a really important one. It's another key framing, and some people are now talking about the right of children and communities to be protected from the aggressive, ubiquitous marketing of unhealthy food. Maybe we can get back to that point. But I wanted to ask you another question, Alex. When I visited with your team a few years ago, we talked a lot about the North American Free Trade Agreement and NAFTA, and you've noted that the trade agreements really shape the global food system and the discussion around ultra-processed food. Could you describe a little to the participants here how that works in Mexico and how the trade agreements contribute to the rise and growth of ultra-processed food?
Yes, I think the best example, I think, is Mexico, about the impact of the free agreement, the trade agreement, and the free market ideology, no, on diet. As you know, Mexico is center of origin of maize. We have a great diversity of maize that have a relation with a great diversity of Mexican cuisine. Different varieties of maize are used for different varieties of dishes. With NAFTA agreement, this agreement, commercial agreement between United States, Canada, and Mexico, the imports of maize to Mexico from United States increased without any control at very, very low prices. Duty imports for maize were canceled, and the great subsidies create very low prices. Maize producers from Mexico cannot compete with the price of maize from United States with these very big subsidies. At the same time, imports of ultra-processed food from United States increased. Supermarket chains like Walmart began to extend around all the country, and all this process destroyed the remnants of the milpa agriculture system. The milpa agriculture system was the traditional polyculture system that produced, together with maize, a great biodiversity of vegetables. Since the 60s of the last century, with the introduction of the Green Revolution, the corporations began to control the seeds, and the use of agrochemicals increased very strong in Mexico. And with the NAFTA agreement, this process was reinforced a lot. In this process, the agriculture subsidies focused in Mexico in the great agrobusiness and abandoned the small farmers. This had a very strong impact in the diversity of food, no, in Mexico. Very great diversity of maize, of beans, tomatoes, everything, no? And the monoculture and intensive use of agrochemicals that destroy soil fertility is the other phase of ultra-processed food, as I mentioned. The principal ingredients from ultra-processed food came from this agri-corporate, no, model, and from the petrochemical industry. No, as mentioned before, no, by Jenn, no, these products, the ultra-processed food, I think, could not be healthy. Why? Because they need to be in the stock market, no, and they need to increase the value of shares. No, for the big corporation, they need to be to have some level of addiction, hyperpalatability, and have a lot, not only these products from this agriculture, but also a lot of products from the petrochemical industry.
Great. Thank you, Alex. I'm going to move on to Kelly now. And just to remind you, in about 15 minutes or so, we're going to open up for your questions and comments. We'll give you two ways to do that. Either you can write your question in the chat and we'll direct it to a speaker, or you can raise your hand and Rosita, our Director of Food Policy at the Institute and our longtime moderator of these forums, will turn on your mic and you can ask your question. Kelly, you've been writing about food and food policy for a long time, and the questions I want to ask you come from that work of yours. And there has been a discussion in nutrition and food policy about thinking about food and particularly unhealthy food as an addiction. And some of that discussion has been connected to ultra-processed foods, which some people say are more addicting or habituating. I wonder if you could summarize that discussion and say how you think it connects to ultra-processed food.
Sure. Thanks, Nick, for inviting me to participate. This is a really fascinating panel. And I want to thank you and Jennifer for writing the paper that got cited in the chat room. It really is a very interesting, it just raises so many interesting issues that I was very grateful to see it appear in the literature. And I also wanted to thank Carlos Montero for his pioneering work on this topic. And I noticed that Carlos is one of the people listening into this webinar, and it sort of occurred to me that me talking about ultra-processed foods when Carlos is listening must be like we're talking about relativity and finding out that Einstein is listening in. So I'm very grateful to he and his colleagues for all the fine work they've done. So
and Carlos was a speaker at one of our earlier forums.
Yes, yes, of course.
I also want to credit his contribution to this topic.
Enormously important advances. So the work on food and addiction came about not because the nutrition field got interested in the topic, but because the addiction field did. And they were actually onto this for 5 or 6 or even more years before our field noticed. And so it's taken us a little while to catch up. But the catching up has occurred thanks to the work of some really good people in the field. And the main question is, can food hijack the brain, the brain and this chemistry, in order to create public health menace? And can food, particularly certain types of food or certain types of processed food, can it hijack the brain such that you get traditional reactions that you see in substances of use? Do you get craving? Do you get withdrawal? Do you even get tolerance developing in ways that lead to overconsumption of these foods and public health damage? And so from the very beginning, one really interesting question is, do you refer to this as food addiction, or do you refer to it as food and addiction? And the word "and" becomes pretty important here, because if you talk about food addiction, the focus could easily be placed on the people that are consuming the food. And of course, the focus here should be on the people who are selling the food and manipulating its ingredients in ways that create addictive processes. And so little nuances in language become pretty important here. Now, the research on this has gone in really very interesting ways. There's human neuroscience work, animal models have been used, human epidemiology has now been done. There are a lot of interesting pieces to this picture, and the work seems to converge on some pretty clear conclusions. And I'd urge people to read the work of Ashley Gearhart at the University of Michigan. She's done terrific work on this, and probably more than anybody else in the field has summarized it into really, really interesting reviews, and is doing groundbreaking research on this too. But what it shows is that things like craving, withdrawal, and tolerance do exist. And the focus early on was on sugar. There was a little focus on fat, but mainly the focus was on sugar. But more recently, some of the attention has turned to ultra-processed foods, as you indicated, Nick. And I think that's a very important broadening of the field. Now, if food if one considers food to have addictive properties, then it raises all sorts of fascinating questions about, should children be the target of marketing for such foods? Should such foods be sold in schools? What about pricing incentives and sizing incentives that encourage excess consumption of these foods? Should the industry be held accountable for selling addictive products like what happened with tobacco and opioids most recently and things? So there are a number of very important outcomes here that are involved in this issue of food and addiction. It seems to me that with the concept of ultra-processed foods and bringing in the concept of addiction, that the field needs a good analogy. I mean, a good way of explaining this to the public in ways that people get, because ultimately the legislators, the litigators, the people that run regulatory agencies are all going to be really important in this. And for them to get the concept, I think, is really important. And Ashley Gearhart, who I mentioned before, back when she was a graduate student, started using the following example to explain this. And she was saying that if you take the coca leaf in its natural environment, it has mildly reinforcing properties, but certainly nobody overconsumes it and it doesn't become a health hazard. But when that gets processed into cocaine, everything changes. And it becomes ultra processed into crack cocaine, then things really change. And people kind of get that analogy. And I think coming up with a good shared analogy could make a big difference in here, because then this term ultra processed, which is not easily understood by somebody who's not really in the field, could, perhaps we get to the understanding more quickly. And I'm not saying that's the best that's the best analogy or that we even need one, but it would certainly be helpful to know what's the best way to communicate about this topic. And so the question is, what does food do to the brain? We know more about that than ever before, and ultra-processed foods seem to be having an impact on the brain, aside from the nutrient composition of the foods that people are eating, aside from how much sugar a product tends to have. The fact that it's ultra-processed seems to be involved in this process. So I think it's really very important work that's going on. And the issue of food and addiction becomes yet another piece of ammunition to argue for change. You've got the nutrition argument, the nutrition and health argument for consuming ultra-processed foods. You're bringing in the sustainability argument and the agricultural impact on the environment. Those are all really important. And now food and addiction becomes another interesting possibility to add into that picture.
That's great. Thank you so much. And you've also written a lot about obesity and both the benefits and the risks of that framing, of that idea, certainly the concerns about stigma and victim blaming. I wonder if you could similarly talk a little about how you think the concepts of obesity and ultra-processed foods fit together, and what might be some ways for public health folks to talk about those ideas together.
Well, I think certainly an agenda can come out of discussions like this. So a research agenda can. So for example, does tolerance develop when people are consuming ultra-processed foods? So if somebody begins eating a certain amount of food and they derive a reward value from that, do they need more of that as time goes forward, so that they're ramping up the amount of sugar, fat, salt, or just ultra-processed foods altogether, which obviously would have health consequences. So there are some research questions that come from this. But it's also very interesting to ask, who are the potential change agents? What changes do you want? And my guess is that we could probably readily agree that less access to these ultra-processed foods would be a good public health outcome. Well, if that's the case, then we have to ask ourselves, who's in the position to do something about that? Now, at least in the United States, we think of the three branches of government, but we tend to dismiss the third. We think of the legislative part of government, the people who are passing laws, and of course they can be important. But in our country, at least, relatively little has happened over the years to curb the behavior of the food industry. There might be good school nutrition standards put in, then they get rolled back, or they get weakened, then they get strengthened. And, there's been some progress on that. But overall, the food industry is pretty much acting like it has in years past, and even worse in many cases. So the legislative part of government in our country is not making sufficient change. The administrative part of government, you know, the regulatory agencies like our U.S. Department of Agriculture and our Food and Drug Administration, et cetera, have similar limitations and make some advances with things like labeling. But overall, is the food industry behaving in a fundamentally different way than it used to? And the answer is completely no. Or if the answer is yes, it's moving in the wrong direction rather than the right direction. And that leaves the judiciary part of our government, and that leads to things like litigation potentially. And so it's really interesting to think about how all branches of government might ultimately play a role. And I think a discussion like that could really help inform that agenda. What do we want our elected leaders to do? What laws do we want passed? Do the regulatory agencies have a role here, and what can be done in the judicial area in order to create change? And this is all based on the assumption that self-regulation by the industry has been a pretty dismal failure from a public health point of view. It's been good for the industry, you know, arguing that you can count on them to make change, but from a public health point of view, has been far less effective. And then I'll just end with one more comment. You know, it seems like what we can bring, the panel and the people on the call can bring today, is a lot of intuition about how this concept is used and how it's best used. But boy, wouldn't it be great to have some data? And it's quite possible that the concept of ultra-processed food creates certain impressions among the policy leaders who we want ultimately to make change that could be good or bad. We don't know. There could be ways to tweak the concept, explain it in certain ways that creates the maximum movement toward change. So it'd be wonderful to do some message framing research to see what this term means to people, and then to see how it could best be used in order to create the social and policy change we'd all like to see.
Great suggestion. Thanks so much for that. And that's exactly what we hope that our panel can contribute to developing such an agenda. We're going to close by coming back to you, Jenn, for a couple questions. And much of your work on food and the framing of food and food policy has been done in Australia. And I wonder if you could tell us a little bit about how the discussion of ultra-processed food has been going in Australia, and whether you see similarities or differences to the discussions in Brazil, Mexico, and here in the United States.
I think, to me, one of the things that's really interesting is who does and doesn't use this concept, and how they use it, which is, of course, very much what all the framing research is about. And ultra processing is specifically and precisely defined, but none of the other sort of euphemistic terms are. So, you know, Paula, you talked about the use of real food, or was it highly industrialized food? There's no definition of that. There's no definition of natural. There's no real definition of processing, really. And so I think one of the things that's interesting is that we have, what I have seen is a relatively small segment of the public health nutrition community comfortably adopts and uses the term ultra-processed. But I have colleagues in the sort of wider public health promotion space, and they don't want to use the term because it doesn't have cut through in the sort of wider consumer space yet. And I think that's interesting. In the same way, you know, I research, you know, commercial determinants of health. Capitalism does not have cut through. I can use that term and talk about it, but you kind of see people run the other way if I throw out the big C word. And so I think in some ways, you know, there's been research, and I think it's often taken up in the wrong way to say that ultra processing hasn't yet cut through. And obviously there's a great deal of sort of, you know, education and other elements that you could do to sort of do that. But even if we're looking at the policy space, I had two brilliant MPH students, Daniela and Maddie, and their papers are in the sort of PDF that Rosita put together. And they went through and looked at all the dietary guidelines, which is probably where we've seen most of the uptake of ultra processing in the sort of health policy community. And even then, it was interesting to see that the use of the term ultra processing was often very much justified by a sort of ingredient-based, formulation-based type approach, not so much about the wider system-level determinants, Brazil and Canada being two exceptions there, I think. And then similarly, we haven't seen some of the, it disconnects with sort of historical policy. So I think even what you were saying, Alejandro, in terms of we've got, you know, when we have those really progressive policies, we sometimes still don't use ultra processing yet in that, just because that's where the evidence and the precedent exists. Australia is probably slow in the uptake, at least in the sort of health policy space. And I think the big difference is just we get to see some very more progressive countries like Mexico, like Chile, and some others that have then created that precedent that can be adopted. I think the other side of it in the Australian context that's interesting is how the food industry has engaged with it. So your point, Paula, that they haven't actually used the term specifically. I think it's really interesting when they do use the term specifically, and there are such few examples of this. I was doing some Googling before we had our call today to see if I could find them. I'm like pumping out, you know, the brand names. I'm like Coca-Cola and ultra-processed, Nestle and ultra-processed. So Nestle was one example that I found. And they actually talk about ultra-processed foods, and they say sort of quasi mea culpa, you know, dairy is obviously a very important part of our diet. Yes, yes, yes. Most dairy products are minimally or processed foods using the NOVA terminology. Some of the ones are going to be ultra-processed. They don't really go into sort of the health concerns about that or disclose that the vast majority of their portfolio is, of course, ultra-processed. But it's interesting to sort of say, okay, we're actually now going to use this term in the same way that, you know, Coca-Cola 2 decades ago said, yes, obesity is a problem, and yes, some of our products may be linked to this, etc. And it's that slow softening of the space to say, yes, we can do this. Yes, we can be part of the solution. Yes, yes, yes. So my research is all about how corporations reposition themselves as part of the solution and how that's potentially very politically beneficial and sort of risky. So I would hypothesize that in the next 5 years, we're going to see many more food companies adopt this term and start being comfortable using it. And that will probably water down the health policy space. What that means yet, I'm not sure, but I didn't answer your question,
I'm
Nick.
reminded,
I'm sorry.
Jen, of the Pepsi-Cola formulation of a few years ago of fun for you food, good for you food, and I'm forgetting what the third category was. I always called the fun food makes you sicker quicker. And that was their way of putting the terminology. I wanted to note that the chat is open for your questions. We encourage you to write questions in the chat. We'll get to them in just a minute. And we also, if you want to ask your question in person, just put your hand up and Rosita will call on you. But a last question for you, Jen. It's a point you talked about when you first started. Could you say a little more what you think the risks are of the reformulation concept of ultra-processed food? And is there anything we can do to minimize those risks or reduce them?
I was thinking about this a little when Paula made the point that we draw parallels between tobacco and ultra processed foods as a category. That's very problematic. And I was thinking, yeah, okay, if I want to wear my very controversial hat, what would be the examples where people are going to get really upset about this? And my thought was, the undernutrition community. And we'll just say, full disclosure, I hate the term undernutrition, overnutrition. If you're interested in, like, my friend and colleague Jurgi Skrenes, who also does lots of work in this space, says, you know, but they're all kind of the similar things with malnutrition. The point of this, though, is that lots of times in sort of food and hunger spaces, you see lots, you know, refugee camps, areas all around the world. What we see in terms of the sort of emergency food supply is lots and lots and lots of ultra-processed foods that are very heavily fortified with all of that stuff. The famous plumpy nut that Pepsi created. And so I think the risk perhaps of and that's just straight up reformulation, not even the ultra processed food reformulation. But if we're just focusing on the if we have a narrow formulation, hypothetically, we could take Nestle and Coca-Cola's portfolio, pick every single product in their portfolio and tweak it, right? But we're still going to have the packaging, we're still going to have the promotion. The extent to which that is also part of the ultra processing concept is, you know, debated somewhat. I think it's an important element. But hypothetically, we could have water, we could have processed, but not ultra processed foods making up these big portfolios. Probably not the same profit margins. There's going to be some other challenges with durability, etc. But there's still going to be huge monolithic corporations. There was a year in Australia where most of Coca-Cola's revenue came from its bottled water portfolio. So immediately, yes, we've got the environmental dimensions that are addressed. But I guess it's sort of saying the very biomedical health technical concerns that often get focused on with that NCD agenda with ultra-processed foods sort of misses the point of the fact that it's the fact that there's slavery in supply chains and that we have huge monocrops around the world and all the other sort of big picture elements. So if we're just tweaking the little bits and pieces and letting all of the massive multinationals that dominate most of these supply chains in the sectors, whether it's the trade or the commodity or whatever else it is, it kind of misses the point. I've never been so much concerned about the particular product makeup. I've been much more concerned about who owned and profited from that particular product in the makeup. So I think that is the risk, as well as, I guess, you know, fortified foods are considered one of the best buy solutions, right? But it's the best buy solution that's hugely ultra processed, so it just lets that sort of perpetuate. Does that kind of answer your question? I feel we should just move on to a wider discussion.
Thank you. And I'm seeing a bevy of questions coming online, so I think we're going to get started. And I will read them out. And if the first question comes from Simona Ballone. Thank you, Simona, for your question addressed to Jenn or me. Considering the negative impact of animal farming on the environment and climate, and how necessary but hard it is to change consumption habits, non-animal product alternatives could be useful to reduce animal product production. However, many of these products can be classified as ultra-processed. Using this definition of ultra-processed may endanger this mitigation solution. What do you think? Jenn, but anyone else too, want to talk a little about alternatives to meat and the connection to the ultra-processed food debate?
I'd say if you're at all interested in this, read IPES. They did an amazing report on this that goes into all the issues of politics. My quick and dirty answer is, I guess I would dispute the premise. Consumption and production of animal products is definitely not always a problem, I would say. Many farmers around the world would have an animal that provides all kinds of really important sort of labor dimensions to that farm. It's part of a closed loop, holistic, sustainable system. I would say large scale industrial animal production. Yes, we can raise all kinds of environmental concerns about that. Lots of stuff around the sort of industrial processed meat. So I think there's perhaps a little bit of a straw man element to the whole animal question. In terms of whether or not alternatives to that can provide a thing, absolutely yes. But I guess the other part is, if you look, at a country like India is held up as an example of an often very vegetarian country that has relatively low meat consumption. You don't need ultra processed foods to reduce one's meat consumption, if that was the goal. That's my short answer.
Great. I'm going to keep moving to see how many questions we can get to. A question from Jim Krieger. Hi, Jim. Happy to have you here. One barrier to moving policy forward, he writes, is a definition of ultra-processed food that is suitable for use in drafting legislation, getting to some of the points you made, Kelly. Do you have suggestions for a definition? Anybody?
I think that there are some different definitions. I think so. And one, for example, that we are using in the case of regulation of food and beverage inside school is to talk about cosmetic ingredients, no, and also about sugars and fat. But I think that some all the ultra processed food that I know, most of these ultra processed food have some colorants, savors, aromas, and everything. Most of them are artificial, no? And I think that this could be one of the definition. It's not the only one, but could be one of the definition that also Carlos Monteiro, no, sometimes agree with this kind of definition, no? But I think it's not for all the products, but for most of the products.
Another question from Aline D'Angelo Campos. And this is for everybody, but particularly for Paula and Jenn. The comparison made to tobacco control was interesting, she writes. Would the shift away from a focus on specific nutrients and ingredients indicate that policies such as taxation and labeling are not the best strategy here? Those interventions work well for tobacco, which is an unnecessary product, but there's a key difference when it comes to food. Everyone needs to eat, and convenience is an important driver of UPF consumption. Paula, do you have thoughts on that?
Yes, I don't think we need ultra-processed food. I mean, the categories that we are talking about, and I mean, we can have discussions about the definition, but we can also have, I mean, what type of foods you are incentivizing. I mean, I'm not saying that you should forbid them, just like we are not forbidding cigarettes, but they should not receive all the fiscal incentives that they receive. Just to give a very pedagogical example, in Brazil, the tax system is so outrageous that an organic piece of pumpkin at the end of the production chain pays more taxes than a can of Coke. So there is something fundamentally wrong. And yes, we can use like a tax system to promote like healthy and adequate diets and to prevent people from eating ultra-processed foods. Should not be forbidden, but it should not be incentivized. So I think in that case, they can have the same type of regulation we had for cigarettes. They are superfluous products. And just a very tiny comment about what Jane brought. I think an emergency situation, it's a different situation when you talk about like what types of diets we should promote like for the entire population through public policy. So it's, of course, you can have room for different types of like situations for specific undernutrition emergencies, but we should have food systems that are based on real food. And when we talk about ultra-processed, we are not talking about processed foods, right? So that should be clear. And of course, there are ways of processing foods that would extend like the conditions of the food to be still healthy. So it's a very specific category. And I shared earlier in the chat, I mean, I think it's very helpful for policy purposes to have the figures. I mean, how many people die because of ultra-processed food consumptions? And when you look at this figure, it's pretty easy to compare with cigarettes, right? You're not forbidden to eat it, but it should be not like a very small percentage of your like diet. We need to protect like the percentage of people's diets. And I think the problem is that in many countries, ultra-processed foods are a large percentage of the population's diets. And I think that's where the challenge is, which is why I respect that in the US you talk about reformulation, but in Brazil we should not be focusing on reformulation. We still eat a lot of real food and we need to protect that. So I think the discussion is also different from place to place. And in that sense, cigarettes are different than ultra-processed because we're in different stages in what we eat as a population.
Thank you for that. The phrase I've sometimes heard people give in response to that question is sugar-sweetened beverages, Coca-Cola and Pepsi, are more like tobacco than they are like food in their impact in the world.
Can I add one?
Sure, Jen.
Can I add one thing to that? I guess I was going to say, to the point of convenience and to the point of question, I guess, of is this the best policy? I think the other part would be to say the convenience if we want to decrease the consumption of these, if we're looking at the population thing, it's not just about decreasing the access to the harmful things, it's also about increasing access to all the other stuff. And I think that's where the convenience argument becomes really challenging, because if I pay myself my living wage to do a lot of the stuff and the preparation for it, sometimes it's cheaper to buy ultra processed foods. As a relatively new mother, and this is a very controversial thing I'm going to say, it would have been cheaper for me to use formula for my kid. Like in terms of all of the bits and pieces when I was expressing and doing all this other stuff at work and paying, like that's shit. And so I think there's some really important, bigger structural social policies around women in the workforce and who's doing the cooking and all of this other stuff. And that feminist gender angle that comes into food production is often left off the agenda with some of this. And I think that's a really important dimension when we talk about equity and gender and the convenience of these foods. I'm in no way saying that we should all, make it easier to access infant formula and ultra processed foods. But I think if we don't address those wider structural policies, there will be an element of inequity immensely in some areas of this conversation. Sorry. But
yes, thank you. And I think we haven't talked so much about the labor side of this, but one reason ultra processed food is so cheap is that so many workers are not paid adequate wages. And the strong organizing drives of McDonald's workers, of Starbucks workers, here in the United States of Chipotle workers, shows that workers who are involved in ultra processed as well as other kinds of food, if we paid them a decent wage, they would be able to afford healthier food, and they wouldn't, so many of them, need to get SNAP and other food benefits subsidized by taxpayers rather than by their employer paying them a decent wage. Here is a question from Eli Matern. Again, thank you for this question. In areas where there is a sugary beverage tax, but clean water is scarce, are there measures to make clean water more affordable and physically accessible? Alejandro, I wonder whether you might want to talk about that.
Yes, when we promote the soda tax in Mexico, we ask to direct the taxes, the income in the government to water fountains inside schools, because inside schools in Mexico, in most of the schools, the kids not have water to drink. And this is terrible because they are there without go out for 5-6 hours, and they need to drink something. And we obtained to begin a program in Mexico to introduce these water fountains, but the government denied to direct these resources to water fountains inside schools. But we know that in the case of other countries that improve soda taxes after Mexico, because have this impact in another countries, you can direct these taxes to obtain, and to give access to drinking water for kids, for example, inside school, but also in public spaces, And we need to do this with fiscal policies, to put taxes in these products that have external impacts, in the budget of the government, but also in the budget of families, and direct this to the more vulnerable population.
Nick, if I might add something quickly to, when
Please
you
do.
asked that question of Alejandro, it reminded me of something that it would be nice if the field could develop enough data to coalesce around what the most effective policy interventions are likely to be. We have people in our field who work on marketing, for example, who will make, I think, a strong argument that there should be less marketing of such food to children. There are others who work on pricing incentives and say a tax might be most effective. It'd be really nice. And then others might say, well, what we should demand of the industry is reformulation of the foods along a certain line. So it'd be nice to figure out which of those approaches might have the most desired impacts, and then focus on that as a policy agenda. And people like Steve Gordmaker have done wonderful work on modeling the impact of different policies.
Yes, and one example of that is removing the deduction that the food industry can use for their advertising from their taxes. A deduction available to all industries, but when it's used to advertise unhealthy food, ultra-processed food, ends up imposing costs on the public. So removing that tax deduction would be one way to discourage food industries from advertising that.
Right, and compared to the food industry, we have precious little political and financial capital to work with. So it would make sense to find the things that are most effective and focus on those.
So I have a question from Raquel Burgess. Hi, Raquel, nice to have you here. In your opinions, what are the most effective strategies? This gets some to what you were just raising, Kelly. What are the most effective strategies for reducing the adverse health impacts of ultra-processed food? What type of strategies should be prioritized? Someone want to start on that?
I would say a large global antitrust push to break up large corporations, because then they wouldn't have the capacity to have large scale marketing and advertising. You wouldn't have the same sort of large industrial supply chains. Whole other question about political feasibility. That's my cheeky answer for this question.
You know, my instincts tell me that taxes are a pretty darn good way to go, because they raise money rather than cost money. And the effects of these have been documented in a number of countries around the world, including Mexico. And but that doesn't mean that I know what effect it would have if marketing practices got changed or if the industry was forced to reformulate. That's why an evaluation of the different approaches would be helpful.
Yeah, and I think that in one side, it's important to have these fiscal policies, like taxes to these kind of products that are commercial determinants of health, but at the same time, subsidies, for healthy food and for healthy environments, and to access, because in the case of Mexico, we have 1.5 million points that sells Coke, junk food of Frito-Lay, all these products in 1.5 million points in the country, and we need to find a way to offer healthy food. And you have small producers that not have the chance to introduce this in the market because we have the control of Walmart and all these companies, that define, the products in the market.
And I think the question of what works to best reduce it is place specific, and in places where the presence of marketing of unhealthy food is ubiquitous. In the work we've done here in New York City, we've started with counter marketing campaigns, often designed by young people and consumers. And that is a strategy that can increase community support for regulation and put pressure on regulators. By itself, counter marketing won't ever have the power of the food industry to reach into people's house and social media and television and radio, but they can change the conversation. And at the CUNY Urban Food Policy Institute, we've trained young people to develop counter marketing campaigns around McDonald's and Coca-Cola and Pepsi in their institutions, in their schools, in their communities, and then to put pressure on others. And we had a forum just a few weeks ago where we talked about marketing of unhealthy food. And in part because of those campaigns, State Senator in New York, Zelnor Myrie, has introduced a bill to limit marketing of unhealthy food to children in New York State. And that bill was just reintroduced into the legislature this month and will come up for a vote. And we encourage those of you who live and work and vote in New York State to support that bill and to get information and to educate your peers and colleagues about it.
If I may add, Nick, I think we don't have one single country in the world that has the 4 policies fully implemented. So actually we don't know. And the best way to know it, it's by testing it. I mean, we should try it out. I mean, we didn't have the evidence about what works in tobacco control before we tried it out the way we have it today. So there are no, like, for example, horrible consequences of trying to restrict marketing of unhealthy products for children, or having like front of package labeling, like with warning labels. Like, we have pretty good evidence now that it works. I mean, we know that like what is cheaper for us generates more access, and what is more expensive generates less access. So there are some things that we know that they work, and the best way to try them out, it would be like to really implement the 4 policies. We don't have one single place in the world, and the only reason we don't have it, it's because of the food industry, ultra-processed food industry lobby, right? I mean, if we are like honest about it, I mean, some of these policies are like really intuitive. We have to prove what's so logic in everybody's minds, and we have to keep, public health needs to prove every single step. And we should like give the burden of proof to them. Okay, we try it out. If it doesn't work, we whatever, right? But we haven't really tried it out. That's my point.
Yes, good. So I'm going to ask a last question before then asking for some closing comments from each of you. And this is a question from Catherine White that I'm going to modify a little bit. She asks, what data would US citizens need to garner the necessary momentum for policy change? And she's asked, do you think food companies would be more inclined to limit amounts of fat, sugar, and salt, or to institute limitations on additives? But I would like to say, not just US citizens, but Kelly, I'm going to ask you to start with that, but then maybe Paula, Alejandro, and Jenn, you could say what Australian, Brazilian, and Mexican citizens would need to have. What data would they need to have to make informed decisions on this? Kelly, you want to get us started on that? And if I can ask you to be quick so that we can then move on to the needing to close.
I think a lot of the needed data exists already. I mean, the people have shown there are health consequences to consuming these foods, that they're readily available and priced and marketed in ways that make the consumption of them quite likely in the population. So the question is, what is there to do about it? I don't think the industry will voluntarily make changes. They'll do it to a small extent, as some fraction of consumers want better quality versions of foods. But I think overall they won't, and it's not in their interest to do so, because people overconsume the most processed foods with the most undesirable ingredients. So they're going to have to be forced to do it. Litigation is one way to get some of that forcing done, but also regulation and legislation are obviously important. So I think the data exists now. It's persuading people that it's an important topic and change needs to take place.
Right. And Alejandro, do you think there are particular information, evidence, facts that people in your country would benefit from to make informed decisions on this?
It's complex, because I think that you need to create the data didn't change the behavior of the popular of great population. I think that is a question of perception, no? And I think that the concept of ultra-processed food is very easy to understand, no? And we need to create a stigma about it, no? And the government need to be part of this process, no? Because we don't have the resources to do it, no? And I think that it's a cultural process, no? And and depends of the countries. In our case, in Mexico, No, we have a very good traditional cuisine, no, and this process needs to begin to recover this traditional cuisine to give value to this cuisine and to the products. No, for example, in Mexico, if you go to a very poor community in the mountains, no, and they invite to eat a family, it's possible that they don't like to give beans because they think that beans are for poor people and they don't want to show it. And this is incredible, no? And you know that the kids are looking for very young food in these little stores in this community. We need to change it with a different narrative. And part of these narratives needs to begin with education and with this connection with the environment, because food is our deepest relation with soil and with the planet, no? And we need to recover it, no, with the plants and with the ecosystem, because our diets, traditional diets, came from a very strong relation with our environment. No, for example, the maize was the product of 9,000 years to develop from the teosinte, that was very small maize, no, and to develop to the maize that we know now. No, the farmers spent 9,000 years developing, and we need to recover, no, in many ways the knowledge about food. I think this is the process.
Jenn, any quick thoughts about evidence for Australians?
I think the point about stigma and denormalization is really interesting if we think of the success of tobacco. To me, a lot of it hinges on not necessarily the product, but the industry in particular, and this I think is where the policy comes in. The tobacco industry lied, right? Like that is upsetting to people. And if you look at in the climate change space, you know, we've got examples. Volkswagen lied. There's lots of examples where you have corporations promoting one rhetoric and behind the scenes doing other stuff. Coca-Cola's emails got hacked during the election several years ago, and we got to see really interesting behind the scenes evidence of the sort of internal counter strategies. So I would say that sort of to the counter marketing that you talked about, really sort of trying to denormalize that these industries are good and promoting all of these things, and that, you know, as you're saying, Alejandro, you know, it's this, you know, gentrification and, you know, moving upward and for this, the prestige of it. I would say that would be a really interesting element as the education.
And Paula.
Yeah, I mean, in terms of data, we really don't know much about all these additives used like in food processing, and the little bit that we know about it, it's not good. So that should be enough. I think what we have, it's more than enough. I think more than data, we need political will. We need regulation. We know that self-regulation doesn't work. We need public support. So in short, I fully agree. We need to denormalize the ultra-processed food industry to be able to regulate them.
Good. So with just a few minutes left before we need to end, and thank you so much for all your questions, and I'm sorry we didn't get to all of them. And Rosita, thank you so much for hosting this and moderating and getting the questions in front of us. If each of you could take maybe a minute or so and to say, what do you think are the most important things, the most important ways that public health professionals, nutritionists, advocates, and researchers can use the concept of ultra-processed food to encourage healthier food systems, policies, and practices? And I hear your point, Paula, that there's not one thing to do, but if you could say what you think the priority ought to be, each of you, that would be helpful. And why don't we go in the same orders as people spoke. Jenn, get us started.
To me, I think the key value of the ultra processing concept is bringing in that idea of the purpose and the intention behind the processing. And so the focus on the cosmetic and the hyperpalatability and all of that. I think if we think about the responsibility then going back to the food companies and the industry and the executive decisions and the shareholders that sort of underpin that push to design foods in this way, I think if we move the focus away from the particular food products to focusing on the industry behemoth behind them and the sort of power inherent across that, to me, that would be the sort of key value and focus of ultra processing as opposed to other sort of nutritional sort of focuses.
Thank you.
That's my short answer.
Paula.
Yeah, I think I would just pick right there. I think we need to go beyond nutritionism. And I think the ultra-processed food concept, it's really good to go beyond nutritionism. And I think that's really a big paradigm shift in the field of nutrition. And I think it has a really high value if we want to change populations' diets and not focus on individuals nor in single nutrients.
Great. Alejandro?
I want to introduce something that I mentioned, that is when you introduce food, these food products in the stock market by these corporations, and that they need to increase the value of these corporation shares in the stock market, they need to produce a product that the people eat more, and have relation with the hyperpalatability and the addiction. If I need to increase the value of my shares as corporation in the stock market and show it that we increase the value each 3 months, I need that the people eat more and more people eat my product. And I think this logic have a very strong relation with when you introduce the food in the stock market. It's something that I am thinking that we need to begin to understand this logic.
Great. And Kelly?
I think it would be incredibly helpful to have an empirical basis for how to frame these issues, and that the work could be nuanced enough that we would know how to frame things, say, to legislators or to the general public or to fellow scientists or climate activists, whoever it happened to be. That would be very helpful. So if I was a legislator, for example, introducing legislation on this, wouldn't it be nice if I could look to some body of literature to say, how do I discuss this with my constituents in order to maximize support?
Mm-hmm. And I think my closing thought would be to promulgate the message that another diet is possible, and that part of the skepticism is that there is no alternative to an ultra-processed diet, either in the specific or globally. And I think in the ways that we can show locally in a particular school, in a particular community, that another diet is possible, that maybe it's a slow process because the ultra-processed food industry took decades to dominate the global diet. And we show in the places where we work that we can make progress, where the proportion of calories, which are now 57% of the calories consumed in the United States come from ultra-processed food, we can get that down to 50% and 40% and 30% over time by working in our communities, our schools, in the litigation, in legislation, in mobilizing, and to make people feel like there's a role that they can play. I thank you all, our panelists, so much. A really interesting discussion. And thank you so much to all of you who've joined us from many different parts of the world and the United States and New York City. And as Rosita was posting, look at our newsletter and our website for upcoming details about future events. Thank you all, and a good afternoon, evening, morning to all of you.